Welcome to the Invite Health podcast, where our degreed healthcare professionals are excited to offer you the most important health and wellness information you need to make informed choices about your health. You can learn more about the products discussed in each of these episodes and all that Invite Health has to offer at www.invitehealth.com/podcast. First-time customers can use promo code podcast at checkout for an additional 15% off your first purchase. Let's get started.
Roughly 10 to 15% of the U.S. population suffers from gallstones. What are gallstones and what can you be doing about them? That's what I'm going to be discussing today. I'm Amanda Williams, MD, MPH, and let's discuss gallstones. Clearly, we know that gallstones have been linked directly with diet and many things in terms of different health conditions are oftentimes self-inflicted. So gallstones certainly fall into that category. But what exactly is a gallstone? And what different nutrients can you be considering if you have gallstones or you know someone who has gallstones? And remember, oftentimes, if you have a gallstone flare up and you end up at the emergency room or urgent care, then oftentimes, depending on the severity of it, you will have to have your gallbladder removed, so a cholecystectomy. But we want to try and get ahead of this because nobody wants to go in and have surgery if you don't need to. So gallstones themselves are they're hard deposits that are formed from bile components within the gallbladder or within the bile ducts themselves. And they are most commonly formed where there is an excess of cholesterol that gets kind of trapped within the bile and it causes it to crystallize. So these blockages caused by gallstones, this is what drives up that pain. So we get these cholesterol that kind of crystallizes and then it can get wedged within a bile duct and it can be incredibly painful. Now, we know that there are certain things that can increase your risk for the development of gallstones. First and foremost, let's just say it out loud, everyone. Yes, it's the standard American diet. The Western diet is the strongest risk factor for the development of gallstones. Not high in fiber, not supportive of cholesterol, not very good for your gallbladder. You think about what the gallbladder is doing, helping to release bile for the breakdown of fats. So if we have too many fats coming in, we can't keep up, we don't have enough fiber to offset that. Big, huge nightmare. So the strongest risk factor is the diet. Now, we also know that women are more likely than men to develop gallstones. Now, we can look at the hormonal connections to that. Clearly, we know that there is an estrogen-driven component to this and the way that cholesterol is transported throughout the female body versus the male body. There are certainly genetic predispositions. They've actually identified a gene that when this gene is mutated can actually lead to a greater likelihood of the development of the gallstones themselves. Being overweight, which oftentimes is linked with the standard American diet, but obesity is certainly a problem. There are certain medications that can leave you more open to gallstones developing, including things that are commonly prescribed, such as thiazide diuretics. Yes, like hydrochlorothiazide, for example, which many people are on for treating high blood pressure. We can also look at female hormones. And so for many women who are put on different hormone replacement therapy, this also can potentially be a causative agent for the development, once again, of those gallstones. We can look at sedentary lifestyle. Just not being too active, which kind of goes hand in hand, once again, with the standard American diet, overweight, not active. All of these things fall in line with kind of this pathway to gallstone formation and hence pain. So the conventional, route of dealing with this is having the gallbladder itself removed. Now, with that, obviously the pain's going to go away, but now we have just limited the body's ability to do something that it is supposed to do, which is release bile, which is important for the normal breakdown of fats. So this is, kind of the end game, is having to have the gallbladder actually removed. But we also know that there are other things that we can do. We can certainly change up our diet, have more of a plant-based diet, fruits and vegetables, seeds and nuts, healthy fats that the body has a much easier time breaking down. Those high fiber foods are so important because they help with that regulation of cholesterol, so that cholesterol can't crystallize up and form those stones. But then we can also look at different nutrients. Vitamin C happens to be a big one. And we also can look at omega-3 fatty acids. And you may think, well, aren't we dealing with fats? Yes, but we're talking good fats here. Omega-3 fatty acids have been shown to actually attenuate the risk for developing gallstones. We can look at SAMe. And we know that SAMe is very important for all those different methylation reactions that go on in the body. And SAMe has been shown to actually improve bile flow. So this may actually lower the level of cholesterol that is circulating in the bile itself. Certainly things like EGCG have been looked at, vitamin E. But I want to predominantly focus in on things such as vitamin C, because how simple is this? Yeah, vitamin C are one of our most common antioxidants in the body. And we think, well, maybe I get enough vitamin C in my diet. Likely not. Remember, vitamin C is a water-soluble vitamin. So even if we are taking vitamin C in multiple doses throughout the day, that's probably quite advantageous, especially in the setting of gallbladders. So we know that the ability of vitamin C to actually prevent gallstone formation has been supported by multiple different studies. There's actually a relationship between low vitamin C levels, so vitamin C deficiencies, and gallstones. Now, we're not talking vitamin C deficiency to the point that you have scurvy, but we certainly realize that when you have low levels of vitamin C, this can create an environment to which gallstones have a much easier time forming. So I want to share with you a study where they took patients who had gallstones, who were all scheduled for their cholecystectomies, and they gave them 500 milligrams of vitamin C 4 times per day for 2 weeks leading into their surgery. So we're talking 2,000 milligrams, 500 milligrams 4 times per day. So remember, I said in that divided dose. So 2,000 milligrams of vitamin C total for the day, 2 weeks before the surgery every single day. And when they looked at the patients who were given vitamin C versus the ones who were not, the ones who took vitamin C leading into their surgery had improved bile composition. And this is something that researchers said, well, maybe we don't necessarily actually even have to do the surgery now. And this is why it's important to understand this correlation between vitamin C levels and gallstone risk. That's why it's also important to understand the role of your omega-3 fatty acids for easing inflammation in the body. But it's not that it's just doing that. We also recognize that EPA and the DHA that comes from things like fish oil can actually impede the formation, once again, of gallstones. We look at SAMe and understanding that SAMe has this really protective effect, clearly on the liver when we think about the methylation process, but it also helps to improve upon bile flow. And when they gave 800 milligrams of SAMe to patients who had significant biliary or gallbladder issues, that this resulted in a decrease in that cholesterol saturation in the bile. So SAMe, once again, kind of like fish oil, kind of like that vitamin C, it's blocking that cholesterol from becoming crystallized. So all of these different things that we certainly recognize. So we can look at EGCG. We know that the powerful catechins within EGCG certainly can yield a lot of benefit. We also recognize that things like melatonin may even play a role in proper bile production. And milk thistle, Generally, we think about kidney and we think about liver with milk thistle, but they have actually been able to show in clinical trials that milk thistle also can help to reduce that bile cholesterol content. So there's a lot of different things that we can be doing. First and foremost, adherence to a Mediterranean diet. Increase your amount of fruits and vegetables that you're taking in each and every single day. Make sure that you're getting adequate vitamin C, your omega-3 fatty acids. Throw in a little SAMe. And you can also look towards things such as EGCG from green tea and milk thistle. So I want to thank you so much for tuning in to the Invite Health podcast. Remember, you can find all of our episodes for free wherever you listen to podcasts or by visiting invitehealth.com/podcast. Do make sure that you subscribe and you leave us a review. You can follow us on Facebook, Twitter, and Instagram at Invite Health. And we will see you next time for another episode of the Invite Health podcast.